Hi, this is Dr. Dumestri, and I'm going to go over this healthy 35-year-old patient's journey with her breast cancer and reconstruction. So she was unfortunately diagnosed with a right-sided breast cancer, and she opted to proceed with double nipple-sparing mastectomy, the left being prophylactic, and an implant-based reconstruction. We plan to do this as 2 stages, with expanders first, followed by implants. There she is as before and 3 months after her final second surgery. Here she is a week and a half after surgery. She's got the tissue expanders in place and they're partially expanded, almost all the way filled, but not quite. She's got this clear tape dressing that I use for all of my implant-based reconstructions, and that's to anchor the nipple in the correct position. Your skin envelope is a very loose construct on top of that expander implant, so the nipples can kind of go any which way, and this keeps them in the right position. Now, 3.5 weeks after surgery, she gave her office a call and sent us this photo with this green breast. So diagnosed her with a small hematoma, a very small bleed that likely was between the skin and where the expander was sitting. So there's nothing to do surgically, and she did develop some capsular contracture or tightening of that envelope that houses the expander with that persistent green discoloration that took a few months to go away. Now you can see here, finally, once she's reaching 5 months post-op on that left side, that bruising has completely gone away. Things have really softened and settled. And she's now in a really good position for her second and hopefully last surgery, which is removal of the tissue expanders, so those temporary implants on the left, and placement of the full silicone implant. So you can see on the left side there, the shape isn't quite as nice with the expanders. There's a little bit more fold. Everything's a lot more smoothed out on the right. Here she is from before to completely after. So her natural breast on the left, now she's had implants. They are boost implants, high projection, 340 cc's, and she also had some fat grafting, so fat harvested from her belly and flanks to transfer to the breast, giving them that nice shape. Things will continue to settle a bit over the next few months, but overall her shape should remain fairly similar. And here she is looking beautifully restored and feeling great. Both breasts nice and soft.